And this school playground is the workforce of tomorrow. The annual pool of school leavers has always been a source of recruitment for most major employers. But while the demand for labour, and especially well-trained workers, increases, by 1995, statistics tell us, there will be a huge reduction, a drop of 25%, nearly 1 million fewer school leavers on the job market. Couple that with the escalating demands of employers for trained workers with the right skills and expertise. The result, demand could far outstrip supply. But the government has already anticipated these needs. They have created a nationwide training support network which they call Employment Training, or ET, and some £1.4 billion has been committed to it. Already, some of the country's leading companies are taking advantage of this, the largest and most sophisticated training program ever created in Britain. But how can ET be relevant in the healthcare sector? You will be only too aware of your increasing difficulties in recruiting a range of specialist staff. ET is the ideal way to help you provide practical training for the people you choose for the jobs you need to fill, as it is flexible and adaptable to your particular needs. It is mainly used to train people who are at least 18 and under 60 and who have been unemployed for more than 6 months, although others may qualify. To help provide up to 12 months of training for each individual, ET is delivered by a network of training agents who work closely with job centres and are familiar with the local labour market, and training managers who plan the training programmes according to local needs. ET is divided into 2 parts. Firstly, into what is known as directed training. This is training away from the pressures of the workplace, for example at a local college, or using a training manager's own facilities. The other part of ET is practical training, which often involves placements with employers. This gives a potential employer plenty of time to assess an individual trainee for competence and level of commitment.
Hartlepool is an area of high unemployment, especially among the unskilled. Employment training is especially welcome, as we can identify the good workers, and they are obviously excellent candidates for permanent employment, as they are already familiar with the authority and its routines.
The trainee does not have to accept a placement. Neither does the placement provider have to provide a permanent job, though many do.
And they're based at the District General Hospital and at Cameron Hospital.
Can I just check that you're not a diabetic?
No.
And are you taking any tablets at the moment?
No.
Right, you can carry on.
But even those who cannot be found a job at the end of training are still much more employable than they were before.
Swab it with surgical spirits and it will tend to dry it out over a period. If you do it
Especially as, wherever possible, trainees work towards some kind of nationally recognised vocational qualification.
We believe that the employment training principles of employer-led, work-relevant and accredited training will be extremely important to us. Not only will they enable us to provide quality training for people incoming from the labour market, but we will also apply that same quality training to our own workforce. In this way, we can make an impact on the unemployment figures in our locality in South Wales, but also can improve the calibre of our own staff for the opportunities of the future.
One area of training is this creche within the Hartlepool District Hospital, for both hospital staff and other working mothers. Managed by Julie, a qualified nursery nurse, it means that trainees like Linda and Alison receive a training allowance equivalent to their previous benefit entitlement and are paid an extra £10 a week, plus help towards travel costs of over £4 per week. The government may also pay up to £50 a week childcare to a lone parent who is accepted into ET. Hartlepool acts as its own training manager and receives an administration fee of £15 for each trainee who starts, plus £17.50 for each trainee each week as a basic grant to cover training. They have found that participation in ET by no means involves a financial burden on them. There are also supplementary grants available locally, and these can be anything up to £40 per week. Already within the NHS, the largest single employer in Western Europe, ET is being used to ensure that there is a competent and well-trained workforce to take care of clerical needs and learn the intricacies of computer systems in a way that would not have been possible before ET. The X-ray department, as well as medical records, is an area where this sort of training is proving to be invaluable. The choice is endless. Training structured to the needs of each trainee and employer. From working with laboratory technicians in medical pathology to gaining experience in helping to care for the elderly confused.
You've gone quiet.
ET in the healthcare sector can also involve training in horticulture and working alongside the team in a psychiatric department, training to help the occupational therapist.
I fully support employment training. It gives us a chance to look at our skill shortages and to make sure that we can get these right and train for them. It also helps us to bring returners back into the work of the authority. I think the main thing we must do is to make sure that the quality of training is of a very high standard. The reason being that we perhaps will not be able to take all trainees in as full-time employers, but we must make sure at the end of the training that commerce and business will know about South Tees Health Authority training and will be queuing up to take our trainees.
ET is not only for people who are unemployed and claiming benefit, but also for returners, people who have been out of the job market for a number of years. South Tees is planning a return to practice course for qualified nurses that will provide a route back into the profession.
First of all, can you tell me something about yourself, about your work history?
Yes, I started my nurse training in 1959 and I qualified in 1963. I then became a staff nurse and worked on a busy casualty unit, which I enjoyed very much.
Can you tell me how long it is you've been away from nursing, Irene?
5 years now.
Some returners may only require a few weeks retraining to update them before taking on a responsible job. Others may need longer.
The dream can become a reality through ET helping nurses who've left the service to return to practice. In addition, I can foresee developments such as a preparation of the support worker in the implementation of Project 2000. Both of these areas demand close liaison between the Employment Training Unit, the service staff and the Education Department in order to ensure that the concept is fully understood.
If you have it turned on, what happens is the machine triggers itself when the patient doesn't...
Oxford Regional Health Authority has already begun a pilot scheme for qualified physiotherapists and occupational therapists who want to return to work. The course is aimed at rebuilding returners' confidence in a work environment, as much as at bringing them up to date with new techniques.
It certainly fulfills our purposes because the programs that we have set up are heavily placement orientated, which fits in within ET, which is a mixture of practical and academic work, and it certainly fits in with the needs of the people who are re-entering the health service.
So, there are many obvious benefits to be gained with ET. It can help all employers in the healthcare sector secure a steady supply of well-trained and highly motivated people to fill the job vacancies well into the next decade.
The Royal College of Nursing warmly welcomes the employment training initiative taken by the Department of Employment. It presents marvellous opportunities for managers in healthcare to bring back some of the tens of thousands of nurses into the service because we need them badly. It also provides opportunities for recruitment into the profession itself. To us, it's an opportunity not to be missed.
I personally believe that every authority in the country has a responsibility not only to the health service but to the community to take on employment training.